Thank you, Dominique. Welcome everyone to our panel. And my name is Sima Thorpe. I am the Executive Director of the ARC of Spokane. Each of us here presenting today, we wear many hats. Another hat that I wear is I'm on the board of the Spokane County Human Rights Task Force. Very happy to be with you here today. I will be facilitating the panel after kicking it off. And I ask you all to put your questions in the chat, but know that we are going to answer those at the end of our presentations. So we have saved 10 minutes of time, I hope at least, for those presentations. Also, excuse me, for those questions. Also, we are going to save time by having the presenters introduce themselves during their particular session of this presentation. So we're going to just try to save a little bit of time there. Very, very happy to be with you here. My personal pronouns are she and her, and my identities include my Iranian heritage, daughter of immigrants, and that factors very much into my passion about issues of race and culture. And I just want you to know and be transparent about fuller reasons why I'm here today and why we are engaging in this presentation. So again, I am the Executive Director of the ARC of Spokane, and its mission is to promote independence and choice and enhance the quality of life for people with intellectual and developmental disabilities and their families. So next slide, please. So we use a lot of jargon in this field, and these are three terms you may hear quite a bit today during this presentation. We will shorten intellectual and developmental disability to IDD. So if you hear IDD, that is what we mean. Self-advocate means speaking up for oneself and one's interests as well as others. But also in the IDD arena, individuals with intellectual and developmental disabilities who are advocating for themselves, and others also will identify themselves as self-advocates as well and use that term. DDA, Developmental Disabilities Administration. So you may hear quite a bit about DDA today. Next slide. So wanted to share with you what is bringing me in particular to the table to talk about inclusion in the conversation in the intersection of disability and race. So last year, after the murder of George Floyd, the ARC of the US took an incredible step. For the first time, they issued a statement calling for the end of systemic racism and discrimination against people of color. We were really heartened to see that. And a lot of our chapters, there are many of us in the state of Washington here and across the United States, we followed the ARC of the US lead and issued our own statements. Unfortunately, we and the ARC of the US, we experienced quite a bit of pushbacks from our own constituency. So for example, the ARC of the US had other chapter leaders, executive directors like myself, question why a disability organization should be speaking out about race. It really took Peter Burns, the CEO of the ARC of the US, to task on that. There was a lot of pushback, but also resulted in engagement of healthy discussion among executive directors. And then we followed, the ARC of Spokane, we followed and issued a similar statement. We also experienced, unfortunately, some questioning as well of our statement, and received very provocative and threatening messages about that. So we believe that we ignore these issues at our peril as an organization and a area of human rights committed to social justice. So disability rights and racial equity, in our view, are inextricably, can't say this word today, inextricably intertwined. I'm going to now show you the next slide, which will have some additional information about why that is. So the Black Lives Matter movement really led us to reflect on how racism and discrimination play out in the disability community more broadly than the conversations we were having among our chapters. Here are some statistics to consider. Labor force participation is lower for Black people with disabilities, significantly compared to those who are white. You see the percentages there. Black children with disabilities lose more days of instruction from school suspension compared to white students with disabilities. Look at that gap. And it's already extremely significant for people with developmental disabilities compared to those who do not have developmental disabilities. 25% of Black students with disabilities never graduate from high school compared to 16% of others. And the cumulative probability of arrest by age 28 is 55.17 for Black individuals with disabilities compared to 39.7 for white individuals. Those are just some statistics just to give you an idea of how this plays out in our world here. Next slide, please. I'd like to now introduce Dr. Aruna Bhuta. Each presenter now is going to discuss these issues with you from their own unique lens and experience. Dr. Bhuta.
Good morning.
Go ahead.
My name is Aruna Bhuta. My pronouns are she and her. I come from India, and I came a long time ago as a graduate student and have a degree in microbiology. But the life experiences and my family circumstances, as I'll describe in my discussion, brought me to work of social work and helping the families with special healthcare needs. I would be sharing some of my lived experiences in terms of interactions with healthcare system, with education system, employment in private versus public sector, and then community integration. When we had, our daughter, we have two children, two grown children, and when we got the diagnosis for our older daughter, which she has the acquired brain injury, at birth, and also too, she had traumatic brain injury due to auto accident, 5 years ago. When we had the physicians that were from different nationalities or different ethnic groups, such as Egyptian or Italian or Indian, at all these different stages, we had much better support and understanding as far as getting the healthcare. But I would share with you one experience when we were new to Spokane 38 plus years ago. Our younger son was not gaining weight, and we were asked that at 1 year of age that he needs to be admitted to the hospital. And we thought pediatrician wanted to sort out the issue as to why he's not gaining weight. And the first day when he was admitted and I was feeding him, and I overheard the conversation of one of the staff person, "Mom is doing fine." And that time, afterwards, it occurred to me that doctor was kind of thinking that I was focusing all my efforts on our 5-year-old daughter, which had significant health needs, and I was neglecting our son. It would be very helpful if the doctors have the supports, the health supports, resources, so that they know that the weight gain of the Asian children is not at the same rate as the Caucasian children, and also to reaching out as to what support systems a family has or doesn't have, and kind of having those discussion makes a much bigger difference rather than, making this kind of decision. And often there are child protective services referrals made for families. And, that is pretty traumatic for the families. So I would kind of draw your attention to the issues of the provider bias and its impact on the services received for families of different ethnic backgrounds. The other issue I would like to bring to your attention is in terms of during pandemic, the crisis care standard that each state had adopted with the limited resources of personal, equipment, PPEs, masks, and also ventilators. And the issues of quality of care had come about. And it has happened in Texas that a 46-year-old African-American man with multiple disabilities, father of 5, was recovering from COVID, and the nursing care facility where he was getting the supportive care made a decision to stop the hydration, the treatment, against his wife's recommendation on the basis of quality of care standards. Quality of care is individual right of every individual. But because of his disability and because of him being African-American, this support system was withheld. So we as families, as well as healthcare providers, and at the state level, public health decision makers need to keep this issue in mind. Access to care is the other area that I would like to draw attention to. There are people with disabilities that are many times on Medicaid, and Medicaid reimbursement rate being lower than the standard private insurance. There are long waiting lists to get the services. Also, there are structural barriers for people with physical disabilities, and also to the exam and maintenance. Quite often obesity and hypertension and diabetes, are the diagnoses that we see in the communities of marginalized community. And we kind of see that marginalized communities and weight management, like if the person is wheelchair bound or if the facility is not wheelchair accessible, then it is hard for the person to get the basic access to basic preventive health care. So that is one area that I would like to draw attention to. Also, the healthcare providers need to be able to communicate with the persons with disabilities, and in terms of cultural issues also, and the language barriers, so that there is a better follow through and these chronic health conditions can be better managed and there is better follow through by the patients. I also would now like to turn to the issues of communication with the individuals with disabilities, so that they can understand the instructions to better manage their own healthcare needs. And quite often we have seen that the issues of diabetes and hypertension and obesity are more prevalent in individuals of communities of color. Moving on to the school district, again, I will begin with my own experience with the school district. When we moved here, again, a long time ago, 38 plus years ago, I was trying to communicate with the school district saying my daughter needs extra help. Can I send the assessment and her individualized education plan so that, she'll be in an appropriate program? I was told that is not necessary, but when she started the school, within first month, received a call from the principal saying your daughter doesn't belong here. Fortunately, I knew the rights, and I said my daughter has a right to education, and proceeded further to get the program that she needed. But I want to emphasize how important it is for families of different nationalities and different colors to be able to get the information, and being on the advisory boards and the outreach by the education systems and the advocacy organization to communities of different nationalities and color is important. Because if I didn't know what needed to happen, our sort of progress would have just hindered from the beginning. And this we have seen often in the communities of color. There is underdiagnosis and misdiagnosis in terms of the supports and the education they get. Quite often also the school districts would see the behaviors in the person of color, child of the color in a developmental stage of 4 to 5 year old, and they would put them as hyperactive and trying to kind of complain about the behavior compared to the issues and needs of the Caucasian child. So we need a lot of support from the education system right from the beginning, so that there is a strong foundation laid for all children. All children need to move forward, irrespective of their color or their abilities or disabilities. And important point I would like to draw your attention to is inclusion. Inclusion needs to happen, and not just in terms of being physically present in the classroom, but in a meaningful way, so that there are friendships that are made right from the beginning, and with that foundation laid from K through 12 for 12 years plus, that the students have the ability, typically developing students know that there is more to a person than the disability, as well as the person with disability has slowly learned to have the adaptive behavior so that they can communicate with each other and learn from each other, both benefiting mutually from their interactions. So when the individuals grow older, they have the support networks of the lawyers and doctors and landlords, as far as housing is concerned, as far as employment is concerned, that people can move forward in their life journey, have the fulfilling lives, productive lives, because as Ms. Sima Thorpe was indicating before, the employment rate is much lower for individuals with disabilities. And also too, the school district educators need to support the individuals with, people with hidden disability is one of the biggest problem, is where person is not using any assistive device or don't have any features so that the people can focus on in the community. Accommodations are not made easily by, say, community helpers or law enforcement. And the individuals may have the language processing difficulties or word finding problem or hearing impairment or mental health issues. And if they can't respond to the request or command of the person that are being put on them, then they can become very easy targets and of the law enforcement or the people in the community. So we need to have some training of the community helpers, as well as we need to have the educators also teaching the students, to be able to communicate, in an effective manner in the interactions with the law enforcement, so that we have better outcomes. Individuals with learning disabilities who don't get services from DDA because your disability has to be initiated before, it has to have begun before the age of 18, don't get any supports from DDA or Developmental Disability Administration. And those people fall through the cracks, as well as also individuals with traumatic brain injury. If the injury has happened after age 18, employment supports are very limited. The skill sets they may have had before with TBI before, they may not have it after the injury, but accommodations are very important. When our daughter had her accident 5 years ago, after she recuperated for 6 months, she was able to go back and continue her work. And I also want to share about the employment opportunity. When she graduated from high school, for 3 months, we tried in private sector for her to find a job, but she was not able to find the job. But in 1999, the year she graduated, the DSHS Secretary, Mr. Lal Qasim, had brought a directive that state agencies will be employing the persons with disabilities. And under that program, she applied, and after 3 more months, she found a job which she has retained for after 21 years. And she was able to return to, even after her brain injury, secondary to the auto accident. And again, I was aware of the resources available in the community. And I would like to emphasize that families and the individuals with disabilities, families of color as well as individuals with disabilities, need to be part of the private sector as well as public sector and the community advocacy organizations and outreach to the families of different backgrounds so that they know what their rights are and they are availing themselves to those services so that they have better outcome and better future. The other thing I would like to focus on is the community integration. And in terms of when the person is fortunate enough to have a job and have gainful employment, they don't have those safeguards that the people who are on the federal benefits, such as supplemental social security income or SSDI, supports. And when, because representative pay is only for the federal benefits, when their person is working on their own and have their own salaries, they are at the high risk of being financial exploitation. And we have had some experiences where, sales techniques used by the sort of companies that they use, that person can just empty out their whole savings account and not being able to pay the rents and their basic necessities. So I would urge people to be aware of the needs of vulnerable individuals and also to people with hidden disabilities, and have people on board of their private and public sectors so that the lived experiences of individuals with disabilities and their families can affect the policies and procedures that are being used so that opportunities for individuals can be better, and also the individuals with disabilities would have more meaningful lives. Thank you.
Thank you, Dr. Bhuta. Let's turn now to Letitia Wood. Letitia, welcome, and please introduce yourself to.
Hello, everyone. I'm Letitia Wood, and my pronouns are she and her. A little bit about myself. I grew up on the East Coast in Northern Virginia, a very diverse area, and I have been an educator for most of my professional career, and 5 years as an international educator. 7 years of that, I've been working specifically with the special education population, specifically kids diagnosed with autism, ADHD, oppositional defiance disorder. In 2019, returned back to the US, and I transitioned to a career in behavior analysis where I'm getting most of my fieldwork experience in the sub area of environmental sustainability within ABA. Due to this being a critical area of intersectionality with the IDD community, also created a company called Legacy Learners, and one of our main service offerings is to work with community organizations to enable them to support kids of color, kids from low-income families, and also kids with special needs around the issue of inclusion. So my request today is just to continue to listen to people that are affected by barriers, not to get defensive, to sit in uncomfortableness, and then secondly, just to begin to take action to help break down those barriers. So what does intersectionality of disabilities and race look like? Well, Dr. Bhuta has already touched on some of the things that I'm going to speak on as well. But the first, I'd like to begin with just discussing like invisible disabilities and hidden disabilities and the impact of late diagnoses. So these are disabilities that you're not able to physically see, and with the Black population, having a hidden disability is a huge disadvantage. For personally, my son, you wouldn't be able to tell that he has some developmental deficits. And when we were overseas and also coming back, access to healthcare was a huge barrier, and is a huge barrier for Black Americans. we didn't receive a diagnosis for my son until he was 7 years old. And, part of that is the Black community is dealing and we're healing with past medical traumas, and it's difficult for us to trust medical professionals. Doctors are dismissive of Black parents' concerns. I know whenever I go to the doctor's office and my kids, I have 3 children, if they're complaining of something, they're in pain, I often do wonder, if the doctor, the nurse practitioner, or the dentist will believe me, will believe my child that they're in pain. And I turn around in the car, we're on our way to the appointment, and I ask them again, are you sure you're in pain? Just because I know that we've had doctors that haven't been receptive and medical professionals that haven't been receptive of our needs. Jumping to specifically speaking on the autism in the African American population, that Black children are 1.5 years later in receiving a diagnosis than white children. And many times they're labeled as behavior problems and not autistic, even though clinicians, they can diagnose autism as early as 2 years old. And after the child does receive a diagnosis, it takes at least 3 times the visits and 3 times as long in treatment compared to their white counterparts. And in another study, Black children with ASD were described as more aggressive and displaying more defiant behaviors. And as we know that the researchers are usually not from that same demographic that they are studying. Another study observed that Black autistics had frequent deficits in eye contact. So if there are indeed differences in how certain demographics present, more studies should be conducted that focus on race and disabilities. And majority of the studies that have been conducted are of white participants. So if this is due to provider biases, then we definitely need to make sure that they're culturally competent. And I'll speak a little bit more on that in a little bit. So if specifically Black Americans are not being served in healthcare, where do they turn? Many times they turn to community organizations in their neighborhoods. But unfortunately, this is also where many fail to receive support. So this is going to the resources for community programs that serve people of color to be able to specifically serve their demographics that have special needs. And as we know that there is a lack of funding support for community centers and other organizations that focus on communities of color, and they're unable to provide support to their demographics that have special needs. And COVID has shed a light on that. And now funders and government agencies are focusing on marginalized organizations that have not received funding, and they're finally getting support. And as they are coming out of being in an unstable state, they're still being left, the communities that have members that have special needs are still being left out. And with there being a lack of support for kids of color and kids of color that have special needs, they're still falling through the cracks. I know my family personally has been able to participate in specific community programs because they didn't have the staff trained to work with kids with special needs. They're seen as being difficult or aggressive, and they might not have a diagnosis, or they have been misdiagnosed. This is one of the reasons why I did create Legacy Learners, one for my son, and but also just to be able to be a support for other families that are dealing with not having the opportunity of inclusion. So we're offering, programs and training and support to those organizations so that they can support their communities of color that have special needs. Also on another note, like just this summer, the first day of summer camp, all the counselors knew my son's name and he sent a timeout on the first day. The other kids, are saying he's annoying and they're complaining to my daughter and asking, why is her brother so annoying? And I don't want this pattern to continue. So we definitely need to make sure that outside of the school system that the community is trained and they know how to meet kids of color specifically that have special needs. Their needs are being met. So this also brings me to really looking at intersectionality at all levels, focusing on climate justice and housing justice. Who are the people that are most likely to be affected by extreme temperatures and food shortages and limited access to resources due to climate change? That would be people of color with disabilities. 2 years ago, I came across a large number of job alerts when I was transitioning into ABA, and the behavioral professionals that were needed in Flint, Michigan for the residents that were poisoned from the water. And who was able to evacuate during natural disasters and who was left behind. Caregivers were noted in leaving their patients behind because they weren't able to lead response efforts that serve the needs of the most vulnerable, and reading articles about caregivers that were leaving their clients behind during Hurricane Katrina because there was no room for a wheelchair in the evacuation vehicles. This is just unacceptable. And then our houseless community members here in Spokane, 15% of the Black population represents the houseless community when we only account for 2% of the population. So further information needs to be done to pinpoint the disproportionality and identify if those community members have invisible disabilities and if they're being overlooked and denied access to resources because they were misdiagnosed or undiagnosed. And if the general population, of the Black community struggles with housing, what does that look like for Black community members with special needs? Could this be a reason why there is such a disproportionate rate of Black houseless community members? On another personal note, my uncle, I do believe is probably misdiagnosed. He was evicted from his home by his landlords. He was then arrested because he tried to return back to his residence, and then he was homeless for a year after we located him. So him not having the access to the resources and the possibility of him also being misdiagnosed. One of my associates here in Spokane, who a Black woman, she's disabled. I just learned last month that she was homeless for 7 years. And actually just a few weeks ago, I recently met a Black social worker here who is developing a group home to address this very issue. And another point is we need to make sure that we are looking at the cultural competency of group homes of the staff members and the residences. And then my last point is the underrepresentation of people of color healthcare providers. I can say that I've never had a Black doctor or a Black nurse practitioner as my primary care provider. Black Americans make up 13% of the population, but only 4% of the doctors. Psychologists, only 5% of the workforce. 3% of providers in applied behavior analysis. So all those jobs that were advertised to go to Flint, Michigan to service families with special needs, where the Black population is over 50%, the majority of the providers were not representing the communities that they serve. So currently there's no ABA programs at HBCUs, and which are the historically Black colleges and universities. When I was looking and transitioning to a career change, only one agency that I applied for actually used a cultural competency model in their hiring. So this is a complex issue. Our providers and companies using cultural competency tools to ensure their staff are able to work with clients that have developmental disabilities, intellectual disabilities that are from different cultures and backgrounds. And it shouldn't be a box that's checked just for hiring or professional development. It should be part of the work environment and the staff culture. So where does this leave us? There's just so much work that needs to be done, and we need to make sure that we're focusing on leading with an intersectionality lens with the most vulnerable and the most underserved community members as we take actions and make decisions with them at the forefront and not as an afterthought or an add-on. Thank you.
Thank you, Tasha. Let's move on to Sorretie Jaro.
Hi, good morning. My name is Sorretie Jaro, and I'm the Spokane County Parent Coalition Advocate with the ARC of Spokane. And I'm going to share with you my presentation on my personal cultural background. First, my pronouns are she and her, and I was born in Richland and Tri-Cities, and on my mom's side, I am raised half Japanese, which my grandmother was full-blood Japanese, and my dad is Ethiopian, which I'm part Ethiopian. And and through living with my dad, and I've grown up eating Ethiopian food. And since I've been raised part Ethiopian, part half Japanese, it's got me learning different things through my cultural side, and being raised Ethiopian has been challenges because my dad speaks a whole different language, which he's taught me a little of some words, but when he speaks, since he's married my stepmom, and since him and my dad speak, her and my dad speak to each other, then it's hard to understand communication wise. And being raised half Japanese, it's not much of a challenge being raised that half Japanese compared to Ethiopian. But I think I'm proud of my cultural background because it gets me more raised in different things. And also being raised half Japanese, it got me connect to have other families that are part Japanese as well, and seeing them learn different styles of cooking Japanese meals. It just seems very interesting. And part of my tradition in my mom's family, we cook on every Friday night, rice and scrambled eggs with soy sauce, and but I don't like fish or salmon. I don't eat that as much. And I never had salmon at all, so I've only had fish, but I just don't really like the taste of the fish. But I like the rice and the chicken mostly. Now I'll be moving on to the next slide. So next slide. So this is my cultural sides here that I've created. The left side explains about the Japanese culture. I've never been to Japan, but and I never even worn that outfit before though. But it just seems a symbol of me, full of my diversity side. And to my right, it's I remember I've kind of worn a dress like that, Ethiopian style closure. But I've actually gained to learn the cultural side of Ethiopian type because my dad watches like TV that shows dancing in Ethiopia and watches little movies. And so that's how I've learned a little bit more of his cultural side. And that this is the true meaning of what is related to me and my style of my cultural. Okay, next slide. These are pictures of these are Ethiopian pictures of what they eat in Ethiopia. The middle picture explains that this is the coffee tea. This is a coffee ceremony, tradition ceremony, and how they make the coffee is they burn like the beans, the coffee beans, and I think they mix it with water. I've never seen how they do it, but that's what I'm thinking. and then they serve it in a ceremony. So you would sit in a table full of your guests, and then they would just pass around coffee to each other. I've never participated in a coffee ceremony before, so that's what I was thinking. And this is bread, Ethiopian bread they would eat. I've actually tried it. It's pretty good bread. It's called dabo. That's the bread. And this is injera, and it's made out of teff flour and with water and with yeast. And so they would, it's a challenge to make it. It takes a long time to make it, but they would stir it in a big pot until it like rises like yeast. So, and then they would roll it up. They would actually put it on a pan, a special pan, a round pan, and then they would roll it up and make it into servings. And then they would use this plate to put the injera on it before they would put the entrees and the sides. And then this meal is very shareable because it's a big plate, and it's good to share it with family. And you can choose to eat it on your own, but it's just too much to eat it. But the food is a bit spicy, but for preference, if you go to a restaurant, they can make it non-spicy if you tell them. But pretty much what I've had was lentils, and I had Jaro, which it's a Ethiopian spice that is very that you can dip it with injera, and you can dip it with bread. I would recommend putting sour cream on the side, because since the spices are very spicy, then it kind of makes it less spicy.
Sorretie, this is Sima. I'm
yeah.
just doing a quick time check. This all sounds extremely delicious, but let's move on to the other part of your presentation, because we're running out of time. Thank you so much. Okay.
Yeah, okay, next slide. So I'm gonna do a short intro here. This is the hot spice, the Burberry spice from that they make while cooking the Ethiopian food. And then this is the Jaro. This is the Jaro that they mix with the Burberry spice with water, and this is how they make the coffee. So they burn the beans. Oh, it smells strong a little bit. And so this is like a whole description of it. Next slide. So through my Japanese cultural, I've ate some white rice, so like rice and eggs I've ate. I've also ate fried rice too. Pretty much Panda Express would be the best option. I would eat fried rice there, or Chinese restaurants. I enjoy eating the egg rolls, but I haven't eaten much egg rolls, but only when I go to not Ethiopian, but Chinese places. or I think I've had egg rolls when I have it with my family too, when they make it. Next slide. So I'm doing a project for my multicultural families and diversities. And the reason why I chose this project is because I would like to reach out to different organizations for people of color. And I would like to bring inclusion into different organizations and learn about their organizations and to form a group. So it gives a chance for people to gather and combine different organizations to learn to learn ways on being included. So we're not leaving people out. and I would like to stop awareness through violence after the murder from George Floyd. I would like to I would like to make it safe for the community. That's kind of what I'm thinking. And my goal is to go to different multicultural organizations and to be able to give a presentation about the Arc of Spokane and to be able to learn more about different cultural aspects into different organizations. So that's why I choose want to do this project and why it's important to me. And yeah. So the outreach is planned to at least 20 organizations and churches that serve people who are Black of color. and that's what I choose to want to do some outreach of. So okay, next slide. Sima, would you like to help me kind of explain about the inclusion, nothing about us without us, a little bit?
Sure. Thank you, Sorretie. Thank you for sharing your passion for your culture and your exploration of that with us through food. I think that helps us understand, your journey and why you're so passionate about including others in it. Our whole advocacy staff and myself are working with Sorretie. We're very excited about meeting other organizations out there and doing a better job to ensure that people with intellectual and developmental disabilities in underrepresented communities are seen and heard. So Sorretie has a huge passion for this. So if you'd like to be included in this project, if you'd like us to come speak to your organization and your group, please let us know and we'll have some contact information at the end here. So inclusion for us means nothing about us without us, right, Sorretie?
Yes.
So this is very much what we're talking about here. The conversation for inclusion in the conversation is that people with intellectual and developmental disabilities need to be at the table where decisions are being made about them. And they need to be also at the table of organizations that are grappling with race and human rights issues. And that's something, right, Sorretie, that you and I have talked about, that we're concerned is that in these movements, such as the Black Lives Matter movements are people with intellectual and developmental disabilities part of it. So are they included? And then are organizations like the ARC also reaching out and including others? So this is a very much a national movement, and certainly at the ARC we've been challenged and to ensure that there is nothing about us without us. Sorretie, right? You challenge
Yes.
us every day.
Mhm.
Thank you. Okay, next slide. So here are some resources. You have the Arc of Spokane and the Arc of the US. Informing Families is an incredible resource for people with intellectual and developmental disabilities. And then as both Tisha and Aruna mentioned, because people who are BIPOC are underrepresented in the IDD community, we really need to get the word out about applying for services. So there's the link there to DDA with information about how to apply. And you have my contact information and Sorretie's there. We can connect you to anyone, any one of us or to others to further the conversation. So let's see, I think we can now open up to questions or comments. Let me check the chat. Let's see. Hi back, Lauren. Thank you for your comment, Panda. Thank you, Letitia, for your contributions. I would echo the gender-based bias in the medical profession. Underdiagnosing IDDs among AFAB individuals as well, particularly in diagnoses like ADHD, especially girls and women of color, and rates of disciplinary actions in schools and internalization of messaging they receive. Thank you. Is there anyone else that has a comment about our presentation or a question for any of us?
Sima, I see we have Will's hand is raised.
Oh, we have a hand raised.
Yeah, I'm going to give Will permission to talk now, if that's
Go
okay
ahead.
with you.
Yes, please. I
Okay.
just can't see the hand from where I'm
Yeah.
sitting. Go ahead, whoever had their hand raised. Okay.
Will,
Sorry, Dominique,
you
I'm not
permi-
seeing it. Okay.
Will Ross, I gave you permission to talk. It looks like you'll need to unmute your speaker though.
Am I muted now?
We're good now. I can
Oh,
hear
okay.
you.
I just wanted to thank ARC for the work that they do. And I know that one of the greatest challenges that we have is working with people with learning intellectual disabilities. And so my question for you is, what are some of the advocacies that you're doing to try to break down the systemic discrimination that this community faces in terms of healthcare or legal system?
Well, that is a huge question. And it is an ongoing fight for those of us in this field. For the Arc of Spokane, we do engage in legislative action. We think that changing policy and being in the fight for policy change is extremely important. That said, we also believe in the grassroots and participate in an organization here called the IDD Champions Network. The IDD community doesn't have a reputation for collaborative and collective action, and we are trying to shift and change that in Spokane. So we're also working with organizations across the state to form something called the North Star Omnibus, which is an omnibus of extremely critical issues for our community, including community-based housing options, which have basically disappeared in Spokane for people with IDD and people of color. And that issue and expanding those options is in the omnibus, as well as others, access to services. So we're finally seeing some movement towards collective action. We need to work with all of our allies for change. Hope that If you're interested in learning more and connecting with our advocacy community, please reach out to my email address.
Thank you.
And I think for, this is Aruna, for healthcare providers, I think definitely we need some further education and medical training of the physicians and nurses and the physical therapists and rehab professionals in general to be more aware of the issues of the communities of color and being more culturally competent. So I think we also need to address the issues at the training level and ongoing education, continuing, CMEs that they get, need to focus on also addressing the cultural competency in addition to the healthcare issues in general, like some of the diseases that are more common, like Chagas disease that is more common in Latinx community than it would be in Caucasian community. Or if a child, with seizure disorder in a frontal lobe area would have impulse control issue. And if the child is African-American male, that will have a great, consequence for that child. And so, kind of the healthcare providers being cognizant of the facts and, supporting the families as well as most of all awareness so that, the individual and the child would have a better outcome long-term. Thank you.
I would just like to thank our panelists one more time, Dr. Aruna Bhuta, Sorretie Jaro, and Letitia Wood. For any of you interested in continuing this conversation, please reach out. We bring this panel to you today because there is a lack of dialogue for inclusion of people with disabilities and people with IDD in the conversation about race and the BIPOC community. So we would really like to see more challenges or more opportunities to discuss the intersectionality of these issues. And if you're interested in continuing the discussion, please reach out. Tisha, Sorretie, any final words?
Thank you for this opportunity to share our stories.
Thank you for the platform. Yep.
Thank you for having me speak to your group.
Thank you all for coming. Melissa just put in the chat, we have a networking lunch that is beginning now, and the link is there if you want to attend. And I hope you enjoy the rest of your conference experience. And thank you again for joining us for this very important conversation. Bye, everyone.
Bye-bye.
Bye.